Hi, everyone. Good morning, good afternoon, and good evening to our audience from across the board. My name is Elaine Charurat, Cervical's Implementation Director for the Immunization Portfolio. It is my privilege to welcome you to today's linking live session on cervical cancer awareness and the upcoming launch of the HPV vaccine in Pakistan. In today's session, we'll be discussing one of the most preventable yet pressing public health challenge of our time, cervical cancer. And as you're aware, cervical cancer remains one of the leading causes of cancer-related mortality among women worldwide, with disproportional impacts in low and middle-income countries. What is particularly sobering is that cervical cancer is largely preventable thanks to advanced medical science, particularly the HPV vaccine offers us proven, simple, effective solution to reduce cervical cancer rates. Countries that have successfully implemented HPV vaccine programs, coupled with robust screening and awareness campaigns, have seen remarkable progress in reducing the incidence and mortality of this disease. Pakistan now stands at a pivotal juncture in its public health journey with the support of our global community and recommendations from the National Immunization Technical Advisory Group, NITAG. The Federal Director of Immunization, FDI, has made significant progress toward introducing the HPV vaccine into the national immunization schedule. This effort, beginning with a phased rollout in 2025, represents a commitment to protecting the health and futures of millions of girls and children across the country. Before we begin, I would like to introduce our esteemed panel. We have with us today Dr. Raul Bonifacio, who is the EPI team lead at WHO. Dr. Bonifacio began his international public health career in 1994, working in South and Southeast Asia, Central Asia, and Africa on humanitarian emergencies. His focus includes primary and secondary care, communicable disease, maternal and child health, nutrition, water sanitation, and outbreaks. From the early 2000s and up till now, he has worked with the polio eradication initiatives in Pakistan as medical officer, national surveillance coordinator, and team leader. And since 2010, he has worked with the WHO, UNICEF, in EPI on national policy, VPD outbreaks response, vaccine introductions, measles elimination verification, and national immunization strategy development. A very warm welcome to you, Dr. Raul. It's wonderful to have you. We also have us today Dr. Mariyam S, who is the Associate Professor at the Health Service Academy and previously as Director of Programs at the Ministry of Health. Dr. Sarfraz is a seasonal public health professional with nearly 20 years of experience in health policy planning and program implementation, specializing in sexual and reproductive health, family planning, and infectious disease prevention. His expertise includes health system strengthening, policy and strategy development, and evidence-based program design. Thank you for joining us, Dr. Mariyam. We also have Cervical's country director in Pakistan, Dr. Aminah Khan. Dr. Khan brings us extensive expertise in family planning, reproductive health, maternal and newborn child health, quality of care, public health disease surveillance, and designing programs for disease prevention and control, infection prevention control, MMR, and other health-associated infections. Her achievements including the introduction of Hep B first dose in Pakistan, and she has held many critical positions in several national and international NGOs and Department of Health, and as well as WHO. Thank you, Dr. Aminah. And last but not least, we're very excited to have Mr. Craig Beyerinck from Gavi with us today. Mr. Beyerinck is a public health professional with more than a decade of experience in leading public health interventions and emergency response in Africa and Asia. Most recently, he has managed high-impact portfolios in Pakistan and Nigeria for Gavi and UNICEF, focusing on vaccine introductions and campaigns, as well as health system strengthening. He has master's degrees for international development from the Graduate Institute of International and Development Studies and master's in international relations from the University of St. Andrews. Welcome, Greg. Without any further ado, we'll begin today's session today. My first question I would like to address to Dr. Rao. Dr. Rao, as you're aware, cervical cancer remains a significant global health challenge with disparities in awareness, prevention, and treatment across the region. While some countries have made significant progress, others still facing gaps in accessing screens, vaccine, and treatment options. In your opinion, what are the global disparities in cervical cancer awareness, prevention, and treatment, and how do you think we can address them? Over to you, Dr. Rao.
Thank you very much for these interesting questions. The global disparities in cervical cancer, especially on awareness, prevention, and control, are especially in the low and middle income countries, are facing high rates due to limited access services and awareness. And while in the developed countries, this has actually been reduced through the screening and treatment programs. Now, to be able to address these disparities, we need a multi-pronged approach that is focusing on the three aspects, which is increased awareness and improve access and vaccination and adequate treatment care. Now, let me start with the issue of awareness. Just a recap on the awareness issues, as we know that more or less this is very much dependent on the age, education, ethnicity, and as well as the race. Now, however, to be able to address this issue, and as we have known that uh, uh, girls with actually lower education actually have these higher incidences, as well as the race, especially in the Hispanics and Black communities versus the white, and as well in some of the South Asian countries are also more affected. To be able to address this issue, I would like to address the first one is to be able to, in order to improve these disparities, we have to really develop and improve culturally sensitive educational materials, and this has to be really appropriate. Especially in Pakistan, we have basically more or less generally 4 or 5 region areas, and we have to develop this one. The second one is the other important thing is that apart from the appropriate educational materials, we need to really empower the healthcare providers, especially with the proper and adequate resources. So the second proposal would be that one, and especially to be able to ensure adequate access to vaccination and screening programs, especially in the underserved population. So this is the third one. What is also very important in this particular aspect is that we have to really approach it, especially in the health education techniques. We have to be, this has to be also a theory based education, whereby we have to define what is basically the problem uh, of the um, of the particular area. So this I would highly recommend, especially for the disparity on the awareness. As for the prevention, we have the primary and secondary. So we have basically our primary, which is the vaccination, and secondary and the screening. Now, I think already 90% of the cervical cancer is in the low and middle income countries, and of which only have around very small number have reached the cervical rates, which is the 4 per 100,000. So now this is quite obvious. The incidence is quite high in the African countries, and as well as the mortality. Now, I think the other issue as well here is that in the low middle income countries, we have around 71% of them has already been introduced into the national immunization program. And but still, in non-Gavi countries, there are also quite a huge number where at least 31 countries have not yet have been introduced. So the socioeconomic factor is a really an issue. Now, I would, as far as in order to reduce these disparities, now one of the suggestions is that, like for example, like Pakistan, we have received the grants from Gavi, especially vaccination. But my concern, which we have discussed with Dr. Mariam in one of the Chapagos with a panel discussion or consultative meeting, is that the country actually needs as well the screening. Um, I think the screening and the treatment. So this basically, we cannot really have this single prong strategy, because even for both for the prevention, which is both primary and secondary, we need the screening, and we need to address this. And I had been advocating, although because I've seen this in other programs such as typhoid, we cannot really mainly rely on really on typhoid vaccination. So there are other components which are actually missing. So we have discussed this matter with the RMCH program and with the regional office. We hope that as what Dr. Mariam was saying, that we need to develop the action plan, because they do have what we call the cervical cancer strategy. So, but hopefully, I think we'd like to focus on the regional office WHO would like to support the development of the action plan for Punjab and KP. So hopefully we'll be able to address this. But one of the suggestions, and I think globally we have, for example, let me start by talking about the grants. So Gavi is supporting the vaccination, so that, and then of course they've been doing this, and they've been linking with several of the companies to be able to have access. So the other one is, I think, one of the improved to access, especially for, is now we're going for the single dose, because we have these two doses, and this single dose can further have an improved access. The other thing which is quite interesting is the other linkages, which is such as CHI and FIGO, and then also Together for Health. There are also grants available beyond the vaccination. So although this might be limited, but I think we should be able to top it. So I think for Pakistan, I think what we really need to see is really have a greater, I think, approach beyond vaccination, because it would not really be enough. And I think we need to tie up this to prevention, which is the primary and secondary. Now, the third aspect, which is actually the treatment, as we know that globally we have very low access in general to to surgical access, and let alone especially on the obstetrics and gynecology, only 29% of that. Now, I think the treatment in Pakistan is still very, very limited. I think Dr. Aminah would agree with me, and Dr. Mariam, and where there are, and these are mainly really centered into the tertiary care hospitals. Now, I think the focus is really, again, to increase the access. Now, but however, though you might be able to have some surgical access care, still the issue of the secondary treatments, such as, for example, like radiotherapy and the other systematic treatment, also needs to be addressed. Now, in some developing countries like the Philippines, or we do have what we call a cancer package by the Philippine health insurance. So there we have, although this is capped to certain amount, but however, there's still quite a significant support financially. I think we need to really advocate. So this is again another important aspect where in that we have to advocate to the government. But again, we have to go back if we're unable to really address this equally, both the awareness, prevention, and especially treatment with the awareness and prevention. So therefore, especially in the low middle income countries, I would actually promote that we have to focus on these two aspects, and but we need to really again tweak and link both the what we call the screening and treatment process together. And so, but I think what we also need I think probably I've discussed this briefly with Dr. Mariam, that I think one of the issue that we need to really underscore and really decide, the government has to decide what kind of the screening method would we have to use it nationally, because so that it can be cost effective, although I think the DNA test would still be the highly recommendable. But I think whether we have to decide whether we need colposcopy before doing the treatment. So I think these are the three main issues that I would like to address. And I think the suggestions I am actually proposing. Thank you very much, Aline.
Thank you so much, Dr. Rao. It's such insightful hearing your recommendations and suggestions for the multi-pronged approaches, really highlighting the cultural issues and also empowering the health workers and access in terms of the service from primary and to secondary prevention, as well as the treatment. So as we progress into the session, it is important to highlight that in Pakistan, cervical cancer continues to be leading cause of cancer-related deaths among women, and yet awareness and education on prevention remains limited. The current curriculum in academic and medical institutes may not sufficiently address those importance of the cervical cancer screening, prevention, or the HPV vaccine. So, Dr. Mariam, considering the current curriculum in the Pakistan academic and medical institutes, what do you think are the major gaps or needs exist in terms of incorporating content on cervical cancer and the HPV vaccine, and what needs to be done? Look forward to hearing your insights, Dr. Mariam.
Thank you very much for first having me, and second for talking and raising the initiative around cervical cancer and the vaccine introduction, which is which has now become a reality for our country. So, with reference to your question about the curriculum in Pakistan, well, the biggest gap is that we don't have a targeted curriculum. It is there in the etiology of diseases. It is there covered in the different cancers which happen, but with specific reference to the cause of cervical cancer and how HPV specifically plays a big role in it. And it's not just the cervical cancer, but it's also in oropharyngeal cancers, in other cancers of mucosal lining within the body. So that aspect is hardly covered. And it's not just the curriculum of the health workforce institutes, doctors, nurses, or other cadres which are being educated in the country. We see a gap and this gap is coming from the different research and different situation assessments done within the hospitals in Pakistan. This gap is also there in the practitioners, especially among the GPs. And the reason I'm raising the GP here is that is the first point of contact for any woman who faces irregular bleeding or some symptom which might really lead to a screening, and then finding out that this at an early stage of that woman having a cervical cancer. So we have a huge gap in terms of the curriculum uh, not adequately equipping the medical students, nurses, doctors with the knowledge about how this cancer is caused, how it can be prevented, and what is the like Dr. Raul said about when the screening should be done, what is the target population who should be counseled about getting the screening, and what are those methods which are low cost and which are very effective at identifying an early lesion, and that's basically what saves lives and saves the morbidity and saves a woman from extensive treatment. And you've already, Ellen, pointed out that this is one of the leading causes of cancer related deaths among women in Pakistan. So that's one aspect of it, that the knowledge among the medical fraternity is low. And the second is that the awareness of it is also low among the general population. They're also not aware of it, that there is a cancer which is preventable and which can be treated, if caught early, and there is a vaccine which is available to completely eliminate this. So it's not just the medical cadres we have to be concerned about. It is also the general population. Now, in terms of what we can do, well, this needs sort of like a system-wide change. The medical education or the health workforce education in Pakistan is regulated by the medical and the nursing councils and the higher education commission. So, what the approach to it would be to develop those curricula and take it to them to be included within the teaching curriculums. The second thing, which I have seen, and I'm sure Dr. Raul and Dr. Amina would also agree to it, and I see some of the comments are also around that fact, that not enough hospitals or obstetric and gynecology departments have instituted the practice of screening target women, especially women who are 35 years of age. So I hardly see in any OBGYN department a unit saying or a placard saying that women should get screened, because that's where women get information about such things. So this practice is not there in our OBGYN departments as well. There is no routine of or a day identified for women to get themselves screened through a very low cost method of visual inspection with acetic acid, because cytoscopy is something which requires advanced skills, which requires a specialist, which requires a laboratory, and it is a costly kind of a test. But we have cheap tests as well. But so your question about the curricula should also include the practicing doctors. I mean, that's an area we need to address, because unless we have that practice within the hospitals where doctors and nurses are trained, unless they see that happening there, their knowledge is not going to increase. So it's not just the pre-service curriculum we have to work on; it is also the in-service training, which has to be worked on. We have some really good curricula available. I'm sure Japaigo can provide access to those. There are those which are already in use in the neighboring countries, and they can be adapted to the context of our country. The third aspect is the misinformation around the HPV vaccine, around the misconceptions and the cultural myths around it being sexually transmitted disease. Yes, true, it is that, but making it about STI, making it a taboo because of its mode of transmission, is another aspect which needs to be addressed. And again, that could be done very effectively through a very well-rounded curriculum which has the counseling aspects in it, which enables and empowers the health workforce to answer the questions of the community, of the general population which come in, and counsel them on getting the appropriate aged girls vaccinated, and the right aged women uh, go for screening, and they take up the screening. The fourth part, which I would really like to bring to this forum, especially as Japaigo and Gavi and WHO are here, somebody in the comments had written about the DNA testing kit, and Dr. Raul had also mentioned that the DNA tests would be the final diagnostics of it. So far, we have in the country, we have those PCR equipment which can detect the HPV virus, but we don't have the self sampling kits yet introduced in the country. And I think that is one of the key things which we can do right now as a low hanging fruit. And that's something which can be maybe in this year, maybe in the coming year, if we plan for it, if we target for it, to introduce at least within the HIV care clinics, because the women who have HIV are more vulnerable to developing this cancer. They are more prone to developing this cancer. So, making available the self-sampling HPV kits is a pretty low-hanging fruit and it would give us immediate screening results as to how many women have it, and we refer them, and the doctors and the care providers can immediately refer them for the diagnostics, for further tests, and for initial treatment. The reason I call it a low hanging fruit and I keep on advocating for it is that we have the equipment available in the country to run those tests and confirm the diagnosis. So with again coming back to your question about the what interventions we need, it is this: we need pre-service curriculum, we need in-service curriculum, we need to train and we need to talk and we need to advocate to the obstetrics and gynae societies, SOGP, which is Society of Obstetricians and Gynecologists in Pakistan, which is it's a very widely spread society within the country, with the heavy membership from across the country of obstetricians and gynecologists in it. So getting them on board to start institutionalizing the practice of screening women for HPV is something which is again the second low hanging fruit. And fourth, we need to also have programs at the school level where the awareness around getting the preventive aspect, which is the vaccine for the right target age, that's an important thing which we really need to work with the education department. It's not just the medical workforce which needs to be made aware. It is also the educational department. It is also the school teachers which need to be made aware of these aspects, and they need to be again given the right materials to counsel the parents and to tell the right aged girls about the benefits of getting the vaccine in time and what it would prevent in the future. So I'll hand it back to you, and if there are any questions, I can answer them later on. Thank you very much.
Thank you, Dr. Mariyam, for highlighting what's already there for pre-service, in-service, and also the opportunities and the tools and available resources we can use. I think it's such a wonderful segue to sort of turning into Dr. Aminah, as Trapaigo has been actively working to facilitate the rollout HPV vaccine in Pakistan, and including the raising awareness about cervical cancer. Dr. Aminah, can you please share how Trapaigo is contributing and achieving these efforts, and what initiatives are currently undertaking to advocate for the HPV vaccine in the larger context? Dr. Aminah?
So thank you, Elaine, for this question. Surely it is going to provide an opportunity to informing Tobacco's effort in advancing HPV vaccine in Pakistan. But before I present Tobacco's work in this area, let me first, for the sake of awareness, explain what HPV is. HPV is human papilloma virus, a virus that is responsible for almost all cervical cancers. And generally, Elaine, when we talk about cervical cancer in Pakistan, a question arises in our mind regarding the burden of this disease. So, few facts that we need to know are that cervical cancer is a serious health challenge in Pakistan, ranking as the third most frequent cancer among women and the second most frequent cancer among those aged 15 to 44. Every day, nearly 20 women lose their lives to this preventable disease. And as the surveillance is limited, the actual numbers may be even higher. The most important point to mention here is that the cervical cancer is preventable, and that is why HPV vaccine matters. The WHO cervical cancer elimination strategy, just like Rahul said, emphasizes HPV vaccination, screening, and treatment as the essential pillars. If we talk about Pakistan, Pakistan is committed to HPV vaccine introduction. Government of Pakistan fully understands that integrating HPV vaccination into the national immunization program will mark a significant step towards eliminating cervical cancer. Gavi, the Vaccine Alliance, is playing a crucial role in supporting the introduction and sustainability of HPV vaccine in Pakistan, and they aim to protect millions of adolescent girls from cervical cancer. Now, coming back to the question, how and what Japaico is doing to achieve this. So for this, I will have to take you back into the year 2020, when Japaico played a critical role in developing Pakistan's HPV vaccine introduction roadmap, conducting a landscape analysis, financial assessments, and stakeholders' engagement to inform policy and planning. Landscape analysis comprised of national and the global literature review, There were 69 key informants interviews across 5 provinces of Pakistan. We had thematic analysis using WHO's new vaccine framework. Financial and economic cost analysis was done. We assessed HPV vaccine introduction alongside cervical cancer screening and treatment scale up. National level consultations were held, followed by dissemination of findings, and then the stakeholders defined the next steps. This roadmap that we developed laid the groundwork for effective HPV vaccine introduction in Pakistan, and it also ensured alignment with the global cervical cancer elimination goals. Jipaigo also supported the development of national cervical cancer strategy for Pakistan. And now when Pakistan is at a critical moment in its fight against cervical cancer, a disease that is entirely preventable, Jipaigo, in collaboration with the Federal Directorate of Immunization, Ministry of National Health Services Regulation and Coordination, provincial expanded programs of immunization, and through the support from Gavi and Gates Foundation and partners, we're leading efforts to introduce, roll out, and upscale HPV vaccine in Pakistan. We are trying this to ensure a healthier future for millions of girls in Pakistan. So recently, Jipaigo supported FDI in WIG application and the National Immunization Technical Advisory Group, the NITAC meetings. Our efforts in HPV vaccine introduction and rollout begins by building consensus and strengthening systems for quality service delivery. We also are working on raising awareness and encouraging demand. And we are also applying monitoring, evaluation, research, and learning. That's MERL methodology, and that's a data driven approach. So now let's talk about building consensus and strengthening system for quality service delivery. We are bringing together the right people to make informed decisions. We have the technical working groups established at the national and the provincial levels to guide vaccine introduction with representatives from the federal and the provincial governments, technical experts, and policymakers. And now these groups are working on optimizing vaccine delivery. They're developing costed models to determine the best way to roll out the vaccine across different regions. This will be carried out by Jipaigo and PATH, ensuring social inclusion, making sure plans consider the need of marginalized communities, improving information system, so data on vaccine coverage and cervical cancer cases can be tracked effectively. And Elaine, these meetings are being held on regular basis. We are supporting development of strategy and implementation plan of the routinization of HPV vaccine and the cervical cancer elimination strategy as well. We are working on enhancing learning and capacity building. And for this, we are creating a knowledge management hub at the FDI. We're developing operational guidelines, curriculums, and supporting training for micro planning. We will be conducting healthcare workforce training like everybody is asking and everybody knows the importance of it. We will be developing training package to increase knowledge and competency and enhance quality service delivery. Integrating HPV and cervical cancer prevention into the medical and nursing curricula is so important, and we are going to ensure that this happens as well. We also understand that engaging policymaker is the need of the hour. So Jipaigo is facilitating high-level policy dialogues to ensure HPV vaccine integration into the national immunization strategies. We are heavily invested in and will lead the development of Pakistan's national cervical cancer elimination strategy implementation plans. This was the service delivery side. We are also playing a key role in raising awareness and encouraging demand, because we understand that simply making the vaccine available isn't enough. People need to trust and understand why it is important to vaccinate their young girls. That's why Jipaigo is focusing on increasing demand generation as well. And that we are doing by applying behavioral insights and designing communication strategies which are tailored to Pakistan's diverse communities. We are gathering insights through knowledge, attitude, and behavior studies, which is being conducted across all the provinces. We are researching caregivers' perceptions and community barriers. We are ensuring that men, women, caregivers, and local leaders are involved in the conversation. And we will be using these findings to develop culturally relevant messaging for different communities. Our advocacy, communication, and social mobilization activities are establishing harmonized efforts for HPV vaccine introduction through a multi-sectoral approach. We are holding advocacy and consultative meetings at both national and provincial levels. We are developing advocacy toolkits, information education materials. We are actively building awareness through radio programs where influencers and the technical experts participate and provide knowledge on HPV vaccine and, of course, on cervical cancer as well. We are cognizant of the fact that media has a huge part to play. Therefore, we are strengthening media partnership by building capacity of the media on accurate vaccine information and reporting about this vaccine as well. Developing digital health communication tool to leverage social media for targeted messaging is also one of the key interventions that DePigo is taking. Let me inform you here that HPV vaccine will be introduced in a phased approach with one-time multi-age cohort campaign for girls aged 9 to 14 years, followed by routine immunization for girls aged 9 years. Hence, school-based engagement becomes so much mandatory. So our efforts here include training female school teachers and developing them as vaccine champions. We are involving social welfare department, civil societies, and local CSOs in addressing out of school girls' access to HPV vaccination. Lastly, we are applying monitoring, evaluation, research, learning methodology, which is a data driven approach. Japigo is ensuring evidence-based programming by robust monitoring and evaluation mechanism. We will be working on evaluating the impact of awareness campaigns and addressing the gaps in the vaccine trust and the uptake. We will be documenting what works well and what did not work well so that HPV vaccine can be integrated into the broader cervical cancer prevention strategy in Pakistan. Our knowledge management and global learning contribution will definitely ensure establishing an HPV knowledge management hub at FDI, which I've already discussed, to document lesson learned. And what will this do? This will allow engaging in global HPV learning platforms to share best practices. We will support the development of real-time monitoring and supervision mechanism by assisting in the creation of tools to access vaccine uptake and program performance as well. We will be providing training for supervisor on effectively using these tools, and that will support scientific and data-driven decision making. And last but not the least, we also have plans for post-implementation evaluation as well. And these include conducting a knowledge, attitude, and practices studies to measure behavioral changes and program impact. So if I say all in all, Jubaico is taking a comprehensive evidence-based approach, working at the policy level, engaging communities, and ensuring sustainable systems are in place for HPV vaccine introduction. And for us at Jepaico, it isn't just about vaccination, it's about saving lives and protecting future generation from this deadly yet preventable disease, which is known as the cervical cancer. So this is what Jepaico is currently doing for advocacy and introduction of the HPV vaccine. Over to you.
Thank you so much, Dr. Aminah, and for the comprehensive overview. I really wanted to emphasize that Japaigo contributing the larger leadership under the FDI, WHO, UNICEF, and all of our partners. And this effort is really complementary and for really the larger efforts for the leadership. Now we're turning to you, Craig. Gavi has obviously been working across the globe in the ring of immunization and has positively impacted the lives of millions. We're really glad to have you here, and we very much like to hear from you in terms of how is Gavi supporting the introduction of HPV vaccine in Pakistan, And how does the introduction of HPV vaccine build on existing effort to strengthen the immunization systems, where you also see the additional efforts may be required? So over to you, Craig.
Sure. Thank you all very much for your, it's been interesting to hear all of the speakers' input, and I'm happy to be here today. So similar to other campaigns and introductions, Gavi is supporting the multi-age cohort campaign and introduction of the HPV vaccine in Pakistan through in-kind financial and technical assistance contributions. In-kind support includes fully funding the vaccines for all phases of the multi-age cohort campaign and co-funding the routine vaccines with the government of Pakistan. The cost of vaccine doses procured through Gavi is also considerably lower than the prevailing market rates for the same vaccines in other countries, which results in a considerable savings to the government, which was also mentioned earlier. The financial support includes operational costs for the campaign and initial introduction activities across the country. So these funds will be used to build health worker capacity, engage communities and community leaders on the benefit of HPV vaccination, support the administration of the multi-age cohort campaign and introduction, among other things. The third is technical assistance, as I mentioned before, and this is to provide technical guidance and support to the government for implementation of the vaccine program. This includes facilitating the development of data-driven microplans, facilitating availability and use of service delivery data, developing plans for integration of the HPV vaccine into the routine immunization program, amongst many, many other things. For the second question, the introduction of the HPV vaccine will build on existing efforts to strengthen Pakistan's immunization system by leveraging established infrastructure and expanding the reach of vaccination programs. It will also contribute to wider health system strengthening efforts through investments in infrastructure, capacity building, and data routines, amongst others. So the existing efforts include using infrastructure and knowledge from the previous vaccination campaigns, such as the TCV and measles vaccination campaigns that were conducted over the last few years, to effectively introduce this vaccine into the routine immunization system or program. The initiative will also use existing health facilities, schools, and community outreach programs to deliver the vaccine. And the program will also be integrated with other adolescent health programs and school health initiatives. Additional efforts will be needed across the board, as this is not a kind of typical vaccine in the sense that it is for a different cohort of girls, like an age range that is different than other vaccines. So to help with this, here are some of the examples, which include that the EPI will need to recruit and train additional healthcare workers, especially female vaccinators and lady healthcare workers. These will be really crucial to administering the vaccine. Also, creating awareness materials that will be targeted to girls, their parents, religious scholars, politicians, educators, the media, as this will be crucial to building awareness and addressing potential cultural and religious barriers to girls getting the vaccine. The program will also need to ensure strong stakeholder engagement and community involvement, and as well as very robust monitoring and evaluation systems. And the vaccine infrastructure, such as cold chain capacity and waste management systems, will need to be further strengthened to deal with the increased volumes of vaccines and also medical waste. Thank you very much. I'll hand it back to you, Elaine.
Thank you so much, Craig, for sort of sharing the Gavi's role and all the partnership and your vision. As we come to the end of today's enlightening session, it is really clear that the fight against cervical cancer requires collective action at every level, from raising awareness to improving education to expand access to vaccine and other healthcare services. We really appreciate the collaboration and partnerships the delegated professionals today here online, and also, of course, our esteemed speakers. We have colleagues from UNICEF and others who are also playing critical roles, who being active in contributing to this session. So really appreciate all of you. It is crucial to transforming the landscape of cervical cancer prevention in Pakistan and around the world as we move forward. So the introduction of the HPV vaccine marks pivotal steps in reducing the burden of this preventable disease. And as we continue support of the partners and stakeholders under the leadership of the government, we're really optimistic that we can create a future where cervical cancer no longer threatens the lives of millions of women. Thank you so much for the panelists for sharing your valuable insights. And also thank you for the active participation of all your questions and comments to join today. We will definitely be following up with you after this live session. Appreciate your commitment. I believe together we can pave the way for a healthier, cancer-free tomorrow. So please continue to stay informed, stay engaged, and let's get to work. Hope that every woman has the opportunity to live a long, healthy life. And thank you again for participating. And please do take care of yourself and each other.